Meanwhile, social media sites cracking down on COVID vaccine misinformation, YouTube being the very latest to hone in.
But the biggest issue for health experts, combating false info about a federal government database. It is being used to claim thousands of deaths are connected to the vaccines. Experts tell News 4 tonight that is simply not true. Chief Investigator Lauren Traeger deep dives in this News 4 fact check.
Here at News 4, we are always listening to your questions and your concerns, and we know you have had a lot of them during this pandemic. But one particular misconception about vaccine-related deaths continues to come up. For example, here's one email we recently received asking us why we weren't reporting the deaths from the so-called COVID vaccines. The email pointed to a database called the Vaccine Adverse Events Reporting System, with the acronym VAERS. Maybe you've heard of it recently. Created back in 1990 and accessible online, it allows the public and healthcare providers to report the side effects of any vaccine. But interest in it has peaked during the COVID pandemic. And in the last several months, experts say it's being used inappropriately to spread false information about the vaccines.
Guys, I was just given this link by a fellow truth seeker and my mind is absolutely blown.
Social media videos, people's posts, legit-seeming articles, even Tucker Carlson on Fox News have all been using VAERS to spread misinformation, experts say, about the vaccines being directly connected to people dying. And people we talk to say that's highly problematic.
There is no reason to think that those deaths are actually caused by the vaccine itself.
Here's the problem. VAERS is intended to be a massive and passive data collection system. So let's pretend that this is the database. Let's say you have a sore arm or a headache after receiving the COVID vaccine. You can make a report to VAERS. Anyone can. But when it comes to deaths, a person can report a death days or even weeks after receiving a COVID vaccine. And from the numbers, people certainly have been. There's a lot of reports of deaths on VAERS. But that doesn't mean that anyone has actually gone through to determine if the vaccine actually caused that person to die.
Patients who receive a vaccine may be experiencing cancer, or they might have a car accident. And the death and timing is related, but cause and effect is not.
Instead, the CDC will start to go through the data submitted to VAERS and gather more information from things like medical records and death certificates. Over time, they have been determining that the vast majority of deaths reported to VAERS are not connected to the vaccines at all.
The science and the research behind it to look at the deaths just does not hold that up.
That's why the VAERS website is loaded with disclaimers trying to warn people that looking at the raw data alone is incomplete at best and inaccurate at worst. Now, that's not to say there have been zero adverse events from COVID vaccines. The CDC's website has precise information about rare instances of anaphylaxis or allergic reactions, Guillain-Barré syndrome, or even more rare blood clots from the J&J shot, which they say may have led to around 3 deaths nationwide. So let's look at it all another way. The VAERS website says there are close to 130 reports of deaths after someone received a COVID vaccine in Missouri. But is that accurate? We asked for more information, and the Missouri State Health Department says they actually have, quote, no reports of a Missouri resident's death where COVID-19 vaccine administration was determined as a cause of death. And just for comparison, the same health department says close to 11,500 people have died from COVID in Missouri since the start of the pandemic.
They should get vaccinated.
As always, experts say check your sources of information, and when in doubt, listen to your own doctor.
I've had this conversation day in and day out for months, and I'll continue having it for months to come until everybody's protected.
There is actually another vaccine reporting system that looks more at trends, and that's what medical professionals and researchers say they look to get a better idea of what's really happening. We've got more information for you about that on KMOV.com and the KMOV News app. For News 4 Investigates, I'm Lauren Traeger.